As the NFL season moves to Week 14, every single week here on the Dan Schwartzman Show, as you know, we like to bring up the injuries and kind of look ahead to what's happening. And we like to bring the experts on, obviously, to break it down because I'm not a doctor. Never spent 4 years in medical school. Never did residency. Frankly, wouldn't want to. That's why we bring all the doctors, of course, in here. And oh, by the way, I did not stay at a Holiday Inn Express yesterday. Dr. Dante Implicito, Chief of Spinal Surgery at Hackensack University Medical Center, which happens to be the team hospital of the New York Giants, joins us here on the show. And Doctor, you know, I think people have been so talking about knees and hips and lower extremity injuries this year with guys trying to lay off shots to the head. I think people have kind of forgotten about the serious nature of spinal injuries in some of the big names that have been afflicted this year during the season. And I want to start with David Wilson, who was a big-time fantasy pick in a lot of drafts and usually around the second round. He had a cervical neck injury week 5 against the Eagles, and he became numb for a moment after that hit. And the word today has been that there's a chance that he may never play again. Some have said it's a career-threatening type of injury. Kind of break down what a cervical neck injury is for us.
Sure. Well, referring to Dave Wilson specifically, and he actually ruined my fantasy team this year too, incidentally, he has a condition called cervical spinal stenosis, which is a developmental condition. It's essentially the genetic cards that he was dealt, which determine the size of the spinal canal, the canal that the spinal cord runs in as it leaves the bottom of the brain and heads towards the tailbone. So when someone is a sort of a shorter stature and has a genetic predisposition to a relatively tight spinal canal, they have sort of less room to tolerate being hit. He actually had an episode when he was in college that was very similar. He had a blow to the head and was transiently numb, and the same thing happened to him again. And it's a dangerous condition to play with, and it's not easily correctable.
Would you recommend that he not play? I know that there's been word that some have told him it's probably best he never plays again because another severe hit potentially could paralyze him.
You know, that's kind of the scuttlebutt I've heard as well. Without actually examining him and seeing his films myself, it's hard to say. But kind of in general, if I see every once in a while, I'll see a high school or a college athlete with significant cervical spinal stenosis, and that's exactly my recommendation. That, you know, in the risk-benefit analysis, it just may not be worth the risk of being paralyzed.
Every time I hear a neck injury or a spinal injury, you always think the worst, of course. And for Malcolm Floyd of San Diego, he had a terrible neck injury week 2 against the Eagles. And I guess it was a good thing he was only diagnosed as a sprained neck. He did not have to have surgery, but does that make somebody maybe a little bit more susceptible to potentially more serious neck injuries, spinal injuries, if they've already suffered something that we don't consider to be severe right now, but potentially, down the road it could become something more?
Yes, yeah, exactly. That's the case. I mean, when it's almost better when you break a bone because we know a bone heals, but when you have a severe sprain and you stretch out ligaments, many people believe the ligaments are not as strong as they were before the injury. So it's a very scary thing. And incidentally, he got away with a sprain because he does not have the same spinal stenosis diagnosis that Wilson has.
We're joined by Dr. Dante Implicito, Chief of Spine Surgery at Hackensack University Medical Center, the team hospital of the New York Giants. He joins us here on the Dan Schwartzman Show, NBC Sports Radio, NBCSportsRadio.com. One of the most severe things we saw was Green Bay tight end Jermichael Finley. And against the Browns, he suffered a bruised spinal cord, a spinal cord contusion, actually spent the night in ICU and even suffered a brief period of cervical cord neuropraxia. Now, from what we understand, he herniated 2 vertebrae. Okay, C3 and C4. Before we go on any further, explain to us C3, C4, and what it means to have a brief period of cervical cord neuropraxia.
Okay, loaded question. So, first of all, God gave you 7 vertebrae in your neck, and they're numbered C1, 2, 3, 4, 5, 6, and 7. And they form basically, the highest one sits right underneath your skull, and the lowest one sits just above your chest. So between the 3rd and 4th cervical vertebrae, there's a disc. There's a disc between each of the vertebrae. It's a cushion that cushions the blow as you kind of go through life and carry your head around in gravity. So the injury he sustained was a herniation of the disc at C3-4. So the disc basically ejects backwards into the spinal canal and bruised the spinal cord. It's literally, a millimeter or two from being the next Christopher Reeve.
Wow, so that's serious.
That's serious.
And what is
the neuropraxia part?
Yeah, what is that?
So when you ding your spinal cord like that, you get, first of all, there's the initial trauma, and then there's the body's sort of response to that trauma, which is to send inflammatory cells to the area, and those cells themselves cause some swelling, and that combination of thing basically stuns the spinal cord. Again, the next step would be an actual irreversible injury to the spinal cord. So he came very, very close to that. He's lucky that he didn't get that far, and the area where he had the neuropraxia or stretch injury to the spinal cord apparently is healing well, and he's up and around and walking, but he's had some deficits from what I understand as far as coordination and some of the higher cervical spinal cord functions. So it still remains to be seen, how much he'll get back to play sports at an elite level.
Would you say that you expect to see him on a field again? I mean, from what you're saying, doctor, and again, I'm not a doctor, but it sounds to be incredibly serious, and that he's very lucky that he can actually get out of bed and walk today.
Yeah, I would agree with that. I mean, the reports that I read, 2-centimeter bruise in the spinal cord, I'd be very, very surprised if he's able to come back, and if he comes back, if he's able to be at the extraordinary level he used to play at.
Now, they were going to perform something called a single-level anterior cervical discectomy and fusion.
Yes.
What exactly is that?
So that's a standard treatment for the herniated disc he has between C3 and C4, where the disc is removed through an incision in the front of the neck, and it is replaced with a piece of bone, fusing the two bones together. Now, that operation is used for a number of different conditions. And, of course, most famously, Peyton Manning had a anterior cervical discectomy and fusion and came back to be, certainly a Pro Bowler, if not the MVP this year. So I think, he didn't have the spinal cord contusion, however, that Finley had. So it's along the spectrum of injury, but Finley needs it to be stabilized for his future function, regardless of whether he plays football. So we'll see what happens.
Last thing, I remember back in the 90s and before, players wore these big things called neck rolls. Some guys look cool, like Brian Cox. Other guys look, frankly, ridiculous. Do you think the NFL, Doc, needs to go back to possibly giving more protection in the form of a neck roll or maybe more padding on the back area of the shoulder pad to maybe avoid some of these serious injuries and the paralysis that we've seen at the college, high school, and NFL level?
Yeah, it's a very interesting question. I had many conversations with this and my buddies, and we all have kids that are old enough to play sports in high school and college now. The neck rolls sort of fell by the wayside because they weren't really proved to be effective in preventing a lot of these injuries. And some of us, myself included, think maybe the solution to all this may be less protection, so the players themselves don't feel so invincible that they're in there leading with their head and all piled up with a fancy Rydell helmet. And they feel like they can run through a wall. I mean,
right.
If they had the old leather neck helmets, they might be a little hesitant to go lead with their head.
So less protection, so maybe they actually remember that they're human.
There you go.
Rather than these battering ram supermen.
Yes, exactly.
Dr. Dante Implicito, Chief of Spinal Surgery at Hackensack University Medical Center, the team hospital of the New York Giants. Appreciate your time and all the great insight.
Great. My pleasure. Thanks.
There you have it, just a breakdown of the spinal injuries that have been suffered in the NFL this year. It does amaze me how we just don't seem to really think much about it, but great advice there from Dr. Implicito. Maybe less padding makes these guys realize they're human. You're listening to The Dan Schwartzman Show, NBC Sports Radio, NBC